Randy Upper sustained a spinal cord injury more than 30 years ago. Today he works as a health educator, providing clinical support to people with neurological conditions. Welcome, Randy.
Hi.
So you bring clinical expertise as a master's trained social worker and personal experience living with a spinal cord injury for more than 30 years. When it comes to aging, spinal cord injury, and mental health, what's it like to have that perspective?
Well, it's interesting to have that perspective because it showed, like prior to my getting to an elderly or older age, I was able to see from my clients some of the issues that they experience and what's going to maybe anticipated for myself when it comes to aging, but also very much learned that, just like every spinal cord injury, no two are alike. So no two people age the same, and no two people cope with how they age the same.
So it sounds like you saw some things, but also it could have had nothing in common with your own experience.
Absolutely.
Yeah.
And that's a big time what I've experienced, actually. Yeah.
So what have you learned over the years about mental health and aging?
Well, when it comes to myself, honestly, I didn't think it was going to impact me all that much. I was very lucky and went for the vast majority of my 34 years since my injury with having very few medical problems. So I really thought that I was going to be more immune to some of the things that I had seen. So when some of the impacts or some of the issues came up, it impacted me emotionally and mentally a lot harder than I really thought it would.
What came up for you, if you're comfortable? Just
yeah,
one
sure.
example,
No,
maybe.
I've had pain since the very beginning of the injury, and I was always able to find ways to manage that without the use of medication. But then there was a point where the pain became so bad that it was really affecting my quality of life. And so that really hit me hard. I felt like getting onto the part of taking medication was a failure. It was something like I was no longer able to control. And also shoulder problems. I've done a lot of sports, a lot of different activities, and people always said, be careful of your shoulders, be careful of your shoulders. And I thought, oh no, my shoulders are good, they're healthy. And then they really started to go, and I've actually had surgery on one of them, which took 2 years to bounce back from. So yeah, there are just a lot of issues such as, and the weight gain. I mean, how I used to identify or how I saw myself was a very active, athletic person. And also my body image was really important to me. And then so here I am now in more pain. I can't be as physically active because of my shoulders, and with age and with the lack of activity came a lot of weight gain. And so kind of my personal, how I image myself, how I saw myself really changed a lot.
So what does your mental health routine look like now?
Well, thankfully when I was first injured, I had a counselor who used a lot of CBT as a part of helping me deal with, I was a very angry person when I was first hurt.
Can you just do a quick, what is CBT? Just in case people
Cognitive
may not know.
behavioral therapy.
Okay.
So it's a type of therapy that is practice-based, and it really looks at how your thinking, your behavior, and in this case your emotions are all linked together. So it was what she did is she worked with me on what were some of the source of some of my thoughts regarding where I was now, being in a chair, I was 20. And being paralyzed from the chest down really helped me get a hold of some of my ableist thoughts that I brought with me to the disabled world, and how to really, it's like reframing how I was thinking, and the impact that also then had on my emotions, which then impacted my behavior, and then the cycle happens. So it was. And I didn't realize that's what she was doing until I went to school. So I was in psychology, and we took the section on CBT, and I went,
wait a second.
That's what she was doing to me. So fortunately, those tools that she taught me, like back in 1989, are things that I've always carried forward since then. And sometimes I need a reminder and a refresher on that. So one thing that I have is I have my own therapist.
Okay.
So, and I say every good therapist needs a therapist. So I have my own therapist. I also make sure that I always have a purpose, that I always have goals for myself, because we all need purpose. We all need a reason to be. And so I'm always setting goals for myself, and actively pursuing those, I think, really gives me that sense of self-worth again. I also make sure that I incorporate physical activity into my daily routine, and again, one that is good for my shoulders, so we do a lot of hand cycling.
Yeah.
And then there's also a lot of relaxation, so deep breathing type stuff that I do, and meditation type relaxation activities. So that's what, and there's also, and this is really, my wife is huge when it comes to helping me with my relaxation too, because she's very good at identifying when my anxiety is getting to a point before I realize it. So I really find that physical contact really helps too. So she's a big part of that.
Yeah, like grounding. I find that too.
Yeah.
One thing you mentioned a little bit back was ableist thoughts. I was wondering if you could give just one example, maybe unpack what that is in case that language is new to
Okay, so when I would say like my ableist thoughts, that the people with disabilities
Yeah.
cannot participate in various sports. They cannot participate in, for me, a big one was when I had my daughter. Like, there was this big belief that, you know, there's no way, how are you going to be able to raise a daughter on your own? And it turned out I was a stay-home dad that was able to modify my entire world so that I had absolutely no problem being a dad. So it brings into it discounts disability and access, and creates all kinds of barriers. And so that's,
Okay.
I think what I brought with me was a lot of, I'm no longer capable because I have a disability. And it was really hard to get over at first.
That's not a good story to be telling yourself.
No.
So if you could go back, or if you could give advice, both to yourself, thinking of that negative story you were telling yourself, and to others as well, for how to protect your physical and mental health, maybe being kind to yourself, what would your advice be?
Physically, get out there and do things. Get out there and try and experiment. I don't think I would change a single thing that I've done physically, even though downhill skiing, I broke my back a second time. My shoulders, I think what happened to those, it accelerated difficulties because of how hard I trained, because I raced with hand cycles for a while. But those helped me identify who I was. And so I say, get out there and try things. And I really do, and maybe a little biased about this, but I really think that asking for help and going out, and if you are in a rural place where you feel stuck, go to somebody to talk to, and whether that's a therapist or a peer, because the power of peer support to me is, you can't match that anywhere else. So, you know, get out there and learn what you can do. Unfortunately now, rehab stays are very small, or very short. And when I was in rehab, I fortunately had the opportunity to forge relationships and bonds with people. And then other people coming back into the hospital that had been out, you know, living in the community for 5, 10, 15 years. We had that opportunity to learn what is possible.
Yeah.
So for people now that have shortened stays that go out into the community without those bonds already established, I would say make those bonds, make those connections, become part of the community, so that you know what is out there and what is possible.
Thank you, Randy. Thanks for joining us today.
Thank you very much. My pleasure.